Good afternoon, good evening, and good morning. Welcome to the fourth webinar on COVID-19, organized by One Health Bangladesh in collaboration with Global Health Development. As you all know, today's topic is COVID-19 is not going away soon. What measures to be taken? Before we start to go to this session, I just want to congratulate all our participants. Over the last 3 webinars, it has been a overwhelming support from you, and a lot of feedback I got that you have been really enjoying, and will continue to do that. And thank you for attending today's webinar. We have two distinguished speakers today, Professor Mohammad Mahamudur Rahman, as you all know him, and Dr. Sitar Dorji from Bhutan. Before I introduce the speakers, there are some housekeeping announcements for all of you. It will be an hour-long session. Program will be recorded, and then it will be uploaded in the website of One Health Bangladesh. All participants can ask questions, and for that they have to go to the chat box and write the question. We will pick up the questions as much as possible. So this is my turn to introduce you to our speakers, 2 speakers, gentlemen and ladies. You know Professor Mahamudur Rahman. He is an epidemiologist and public health expert, former director of IDCR, and currently working in ICDDRB as a consultant. More importantly, he is involved with many national and international expert committees associated with public health measures, disease control, vaccination program. Above all, he is a technical committee member of the COVID-19 in Bangladesh, advising government in taking different measures on COVID-19 control and mitigation. And I will be introducing you now the second participant, Dr. Sitar Dorji. But by the way, please share with you let me share with you that Bhutan currently is not very well with the internet connection because of last night calamities, and that is why he may not be able to participate as well as we expect. But if we cannot, there will be some alternative. We will cope up with that one. But Dr. Sitar Dorji is an epidemiologist as well. He is a training by veterinarian by training, now working as a director and assistant professor in epidemiology in the University of Medical Science of Bhutan. He is actively engaged in controlling and detecting COVID-19 in Bhutan. This is one of the countries in South Asia is doing very well in controlling COVID-19. We will be listening to him as well if he can join us after overcoming this internet problem. Ladies and gentlemen, with this few background and introduction, I would like now request Professor Mahamudur Rahman to go for his presentation. Professor Mahamudur Rahman.
Thank you, Professor.
So, COVID-19 is not going away soon. What measures, Professor Rahman?
Okay, thank you, Professor Nitish, for introducing.
Professor Rahman, also, please unmute.
Yeah, I have unmuted. Okay. Thank you, Professor Nitish, and also thank you, everybody. Welcome to the webinar. I would say that good morning, good afternoon, or good evening, whoever is joining from where. I will be making a presentation on the COVID-19 is not going away. So I will be sharing my screen with you and see. Can you see the screen now?
Yeah, you have to make it a full screen. Yeah.
But can you see it now?
Yes.
Okay, thank you. Good. So I'll be speaking for about 15-20 minutes with you on the COVID-19, as it is not going away soon, and we are hearing it. And not only that, we are also experiencing the situation in the country that it seems to be that we have to live with this for some time. And I will be talking to you about what measures to be taken and what are the recommended measures to be there. So as you know that there are a lot of things coming up as a recommendation from WHO and different corners that if we have to live with COVID-19, that what measures we have to take and how we have to actually change our system in place so that we can take appropriate measures when it is needed. So in doing so, we have come up with 3 questions actually first that we need to answer 3 questions to understand the whole process about it, because where are we sitting there? The first question is that, is the epidemic controlled? And we have to ascertain that how much, at what stage are we in so that we can take appropriate measures there. The second question is that, is the health system able to cope with a resurgence of COVID-19 cases that may arise after adopting some measures? So that is also a very important issue, because as you know that there are 81% of these will get actually cured by themselves, but the rest, about 14% will attend the hospital, and of them a certain percentage will need critical care. So that type of measures has to be there, whether the health system can cope with that or not. And the third one is the public health surveillance system able to detect and manage the cases and their contacts and identify a resurgence of cases. So these are the 3 broad questions we need to answer to go ahead with this. So when we come to the first question, what we need to be there for this, to answer this question, this is quite sophisticated epidemiologically, may not be very palatable for others, but I will try to make you palatable as much as possible. The first thing is that we have to have measure of the effective reproduction number, which can also be actually stated as R0. So actually we have come up with another terminology, is the effective reproduction number, but I will explain a little bit, and that has to be less than 1 for at least 2 weeks, and only then we will be able to say that it is under our control and we can take appropriate measures in there. And if you can see also here that in the, let me take the pointer for you so that you can understand. So you can see that how it is one case giving up the other cases and how it is progressing. So when we come to this basic reproduction number, just to let you understand a little bit very briefly, that it's the average number of secondary infection which is produced. If we have one case in the household, how many cases are developing after that? So it can be in the household, it can be the community, but what we are measuring here, it is in the community. So if one case gives rise to 2 or 3, whatever at the first stage, that is the basic reproduction number we want to calculate. And we want to tell that if there is a secondary case after a primary case, then if the secondary case gives rise to more cases, that will not be counted here for this purpose. So that has to be made very clear here. And this has to be done on a community, on the population based, on the community level. We have to find out this R0. And if it is more than less than 1, then we say that we are controlling it well. The second point which is coming up nowadays is the effective reproduction number. In my opinion, though this has been suggested by World Health Organization about RT, but this is the same thing what we'll be doing, but we have to take into consideration that if somebody are already who has suffered from the case, from this COVID-19, they will have to be accounted for this calculation. If we have somebody, even after, if we get a vaccine also, if we get vaccine, give vaccine to someone and that that becomes immune, so that has to be accounted for the effective reproduction number. But that will come later on. I don't think that currently at this stage, especially for our country, we would say that R0 would be the best thing to do for us now, for the countries who are getting first. those who have already passed a certain amount of time with lot of infection, they can go for the effective reproduction number. So that is how we will be doing a calculating and also accounting for this first question. There is indication that the epidemic is controlled or not. So this is the first question. The second one is the health system is able to cope with the resurgence of cases. As you know that the number of cases requiring hospitalization is smaller. If the number requiring hospital is smaller than the estimated maximum hospital and ICU bed capacity of the health system, then we will be able to tell that yes, we will be able to cope with. And as I mentioned earlier, that number of patients coming to the hospital, attending the hospital, if the beds are enough for them, then we can say that yes, we are coping with that system. The third one is the public health surveillance can identify most cases and their contacts. So there are a lot of indicators which I will be coming up a little later. The country should have sufficient laboratory testing capacity and have a clear testing strategy in place to reliably identify cases. And that, country like us also struggling for this, and we are trying to cope up with as much as possible. And also you have seen that countries who could do best here actually succeeded, like South Korea and some other countries to mention that they did a lot of testing and they could actually control this COVID-19 in their country. So these are the basic three questions, but in addition, there are also some epidemiological criteria which need to be used to supplement these estimates. Only those three questions might not be enough for us to give the answer for everything. So what has been proposed that some of the epidemiological criteria, if you see that the decline in the number of cases at least 50% over a 3-week period since the latest peak and continuous decline. If this condition appears, then only we can think of whether we will go for shutdown or lockdown or whatever method what we take and other mitigation measures, intervention measures we take. Here I tried to bring in the Bangladeshi scenario here for you, that this is from 8th March, Bangladesh has first case identified, and over the time until yesterday, the number of cases are going up. So, and this is on a daily basis, and this graph is on a weekly basis, average weekly. So this is also an estimate. We can do a averaging of every week and see that what is happening, what is going up or down. So if you can see these pictures, we are no near to this situation, what is being asked to achieve there. So this is another indicator for all of us, the countries, when in the future we'll have to come up with these figures so that we can understand where are we. The second criteria is that less than 5% of samples positive for COVID-19, at least for the last 2 weeks. And this is the graph showing the positivity rate in Bangladesh, the Bangladesh scenario. So when we see the positivity rate, this is also not like, is almost you can see is a plateauing and a little bit on the upward trend. And this is on a daily basis, and this is on a weekly average. And this is also much higher than what is expected, which is 5% of the positive samples. Currently, we are having around 12-13% on an average for our country. So this has to be also another indicator which will tell us which way are we going. So there are other criteria also, which I would like to brought it forward for your discussion. At least 80% of the cases are from contact lists, which is very difficult. I don't know which country can do that because you need strong epidemiological epidemiological contact case tracing in that case, and decline in the number of deaths among confirmed and probable cases, at least for the last 3 weeks. So for a country like us, even if we cannot confirm, we can also think of the suspected cases. That is also another indicator which I'm not mentioning here, but can be taken into account also to see that how much are the suspected cases there. And also the continuous decline in the number of hospitalization and ICU, decline in the age-stratified excess mortality due to pneumonia, because there are usual deaths in the community always. So what are the excess mortality? as age stratified, and which is for due to pneumonia. So pneumonia is another indicator which also tells us how much infection is there in the community. So these are the other epidemiological criteria which will help us to understand the measures. And depending on the answers to the 3 questions and the epidemiological criteria, we have to categorize our country, our region of the country, and also different administrative levels into high, intermediate, and low. And they can be assigned accordingly. Color coding can be given. And based on those risk level, they can guide for adaptation of public health and social measures, what needs to be taken. And as you know, that the public health and social measures are different. We know very clearly about hand washing. This is physical distancing, though we say that initially we were talking social distancing, now we are saying physical distancing, and then also the respiratory etiquette, and also the travel time, because people will have to travel, cannot stop for long like this. So they have to take some measures, and we don't think that in the coming days we will be able to travel as we did in the past. 9/11 changed our life a little bit. Now this COVID will change our life again. And reaching and maintaining a state of low level of or no transmission is our target, where we have to go to live with this in future. So another most important point which I would like to bring it here, which I've mentioned, the public surveillance for COVID. Unless we have a very good surveillance system in the country, we will not be able to answer those questions what we have posed in the past. So we have to have different type of surveillance system at different levels. So the standard procedure what is recommended, different type of, like there could be passive surveillance or there could be sentinel surveillance, where we can have new cases reported, identified, and data including the epidemiological analysis, and also immediate reporting of probable and confirmed cases of the COVID-19, which has to be mandated within the national notifiable disease with requirements. And also we can think of sentinel surveillance where resources might not be enough to cover the whole country, and at different geographical locations. Country like us, we can think of district and sub-district, which is Upazila. And also there has to be mortality surveillance conducted for this also. And the total number of laboratory tests conducted for COVID-19 is reportable each day. I would like to bring here one issue which I have not mentioned here, even for the sentinel, not even the central surveillance. We are thinking in our country also going for some cell phone based surveillance system. And the IDCR was also conducting such type of surveillance in the past. And that is, this is also one method where we can cover the whole country, because our tele density is quite high, which is almost 99% now. The geographical coverage is almost 100%. And we can think of that mechanism also, by means of which we can quickly get the data on it, almost on a real-time basis. May not be the confirmed cases, at least the symptomatic and also some other indicators what we can get from that. And we are also thinking of here also the public health surveillance under the case investigation. We have to have dedicated manpower, and the sub-district and district response teams need to be there for sample collection, contact tracing, all updating on an online database. And 90% of the cases are isolated and confirmed, released within 48 hours of the symptom of onset. So there are different recommendations coming up that even if you cannot test, there are non-test method also which can tell you that you are free from disease. But for COVID-19, we see different scenario. We see shedding of virus for a long time, and we are actually experiencing, even after 28 days also, the people who are suffering are shedding viruses. And there are quite a good number of asymptomatic cases, which actually different countries showed different levels. It's starting from 25%, some countries say 80%, but anyway, we can think of the very conservatively also at least 25 to 30% will be the asymptomatic cases, which will be silently shedding the virus and also spreading the infection in the community. So regarding the contact tracing, as this disease is different, usually for other diseases we say that we do contact tracing for a certain number of cases initial, like 100 or 200. But here, COVID-19 doesn't have any other tool in our hand, like we don't have medicine, we don't have vaccine. So only thing is that the public health measures we have to take, public health and social measures rather we should say. And in that case, this type of contact tracing should be there alongside with mitigation measures. So contact tracing is also a part of the containment measures, but we have to have some mitigation measures also. And this has to go side by side depending on our color code, what we have shown in the past. So what we are saying here, at least 80% of the new cases have their close contacts traced and quarantined within 72 hours of case confirmation, and monitor them for 14 days. And we can think of electronic tool for contact tracing. And there are different countries have got different experiences, and this can be tried also. There are limitations also for this, but for our country also, we are trying to come up with something. So almost coming to the end of my presentation. So my final comment is that to live with COVID-19, these minimum measures, what we have discussed now, are essential to keep us safe. And only then we will be able to know where are we and how much we are with the infection. So that's all here. Thank you very much. I can wait for the questions to come and then answer. Over to you, Professor Nitish.
Thank you very much, Professor Roman. It's a very elegant presentation, and also it is a reflection of the country situation, what is happening. And also there are some clues, what can happen in the future and what can we do in the future. Thank you very much. And I wonder, as I mentioned earlier, Dr. Sitar Durji is suffering from internet bad connection. I don't know whether he's still here or not. Can IT people help me whether he's here or not? No? If
no,
he is
sir.
not,
No, sir.
He is not there. Can you upload his presentation just quickly? We can share and show what has he prepared for us.
Yes, sir. I'm uploading the presentation.
Please. Okay, Sitar Durji has not been able to come, but he has been trying to show us the scenario of COVID-19 in the context of South Asia, and also an agenda of surveillance network that we have already existed for quite a bit of time. Not very active, but that's what is the future he is going to talk about. And if you go to the next slide, you will see this is the story that, originally in 2017, we discussed to develop a sort of framework on surveillance in the region. And then in October, we had another meeting. And also we did a prioritization simulation exercise in 2019. Next, please. And, Sitar Durji was coordinating the whole team in South Asia. There is a participation from Bangladesh, from India, from Pakistan, from Afghanistan, of course, Nepal, and Bhutan and Sri Lanka. Altogether, there is a 8-member technical committee oversight, and that has been supported by the court. You might be aware of the court, and it is now regulated or coordinated by the University of Medical Science of Bhutan. And this is the founding situation, but next slide. And if you can see that, the framework is to handle the emerging diseases, more importantly, the zoonotic influenza, rabies, and CCHF, brucellosis, Nipah, leptospirosis. These are all in the plan. And if there is a pandemic, then we can address using this particular platform at a regional level. Next. And all this vision to engage the partners from public health in public health emergency on international concern. And we are at really an international concern. It is a pandemic, and it is very appropriate to really use this platform as Professor Mahmoud Rahman has already mentioned, that it is not going away. We have to stay with it. How can we really stay with it internationally with this vision? Next, please. And this is a COVID situation in South Asia, as you can see. The number of cases everywhere. And the lowest number of cases, as he has shown, that is in Bhutan. The highest number of cases, as we can see, is in Pakistan. And our situation is not also very good. And also the cases of Pakistan and other areas are not very well. But as you can see in the slide, Nepal is also not doing bad. They have only 444 cases. Next slide, please. And with this situation, what lesson really we learn? None of the countries look, very prepared for this thing. And when it started, everybody was puzzled, was struggling, when to start, how to mitigate, what sort of laboratory support, and most importantly, how to protect the health workers with the PPE, and all those difficulties. And above all, there is a lack of coordination. It is not only in one particular country. I think this is a slide he has prepared based on the experience of all the countries, information that he has gathered. Next slide, please. And also the hospital upsurge, the capacity was not properly planned, and all this technical expertise in many countries has, shortage, public health response, and official declarations, and also engagement was not adequate. So now everybody looks that they are responding, and they responded a bit late. Next. And with this situation, the new normal that he is thinking about, or he is proposing, that COVID-19 is not going away. So what we have to do? We have to develop a sort of regional network which can really facilitate sharing and dealing the COVID-19 nationally, locally, as well as internationally, regionally. We need to develop a sort of institutional arrangement, how we can really collaborate together, and we need funding for that. And also need a regional plan for future epidemics or pandemics and major epidemics, including AMR. And all this preparation should start from now on, because next pandemic is not anymore a long-distance one. We cannot say that. With the COVID experience, we have been talking about a new pandemic will emerge. Now it is here, and we can see how unprepared the whole world as such was. And it has been recognized even in the last week, WHO, World Health Assembly, that world as a whole was not well prepared, with the exception of 2 or 3 countries like South Korea, Taiwan, Germany. These are the few examples only in such a big world that they are doing better than anybody else. That is an experience that has shown that we need to be prepared globally, regionally, and nationally for any other future pandemic. Next slide, please. And with this one, what he is suggesting that we need to develop a sort of One Health surveillance network, because we all know that the source is the most important one. Same is the case with the COVID, and also not the COVID, and the earlier one, that most of the pandemic tests that we have encountered over the last decades are all from animal sources. And we have to be very cautious about this thing to identify the source and improve our detection capacity, above all, to work together across the border. And that is the preparation that we need to do in the umbrella of One Health South Asia Network. Next slide, please. And with this thing, we can do a lot of other things. We can train experts, we can share experience, we can collaborate with the tripartite WHO, FOYE, we can customize our situation. And furthermore, all these surge needs that we, say for example, it is not written there. The vaccine is one of the most probable solution for this COVID-19. And we have to prioritize how can we really get them available if we at all get a vaccine. How this vaccine will be available to all the countries. And a sort of regional concerted effort might help in that thing. It is not only vaccine. If we get a drug even, how can we really get this thing? There are a lot of discussion going on among the international community, and what is the priority? How can we really prioritize? How can we really support each other? A regional partnership. Our Honorable Prime Minister, when they were talking with all these regional leaders, she categorically mentioned this thing. I think this is one of the most foresighted proposals she has made, that we must get together with an institutional development in our region to combat any sort of pandemic that might come in the future. And I think we should capture that goodwill of our politician right at the moment as a professional, particularly as a One Health community. We must take this opportunity. Next. And I think that is we can do a lot of things. These are all the list what we can do together. SOPs, ARRs, COVID-19, and above all the research and assessment, policy decision, policy influence. Next, please. And these are all already talked. Can you go to the next? And I think that is all about the presentation. I have just taken the opportunity in absence of Sita Dorji. It is basically his presentation. My name is there without any contribution. I don't know why has he put my name, but that's what he wanted to talk. Maybe we can share Professor Mahmoud Rahman will be also able to share some of his opinion when you put the questions in front of us. So this is the end of Sita Dorji's presentation. Now we'll go for question and answer. And I will start with a question for Professor Mahmoud Rahman. Professor Mahmoud Rahman, you mentioned about this R0 and RT. Professor Foyez has asked you a question. What is the smallest unit of calculating RT? And along with that thing, he has also asked a question whether we should go for testing with the asymptomatic cases under present situation, because we are also guessing that we'll have a lot of asymptomatic cases. Can you respond to that? Over to you, Professor.
Yeah, thank you, for sir. Actually, this is the same calculation that is done for R0. This is the primary case, and how many cases are coming from a primary case. If we get 2 or 3 cases, or maybe for if you talk about measles, it is about 16, 17. So, and we have to multiply with the susceptible population to get the effective reproduction number. So that is the calculation we can do. And that is the same only thing we have to bring in the susceptible population. As I told also during my presentation, that currently, in my understanding, we don't have to consider the susceptible population at this stage. It might be necessary in the coming future, because we are thinking the calculation, what we have shown, the indicator, what we have shown that this will have to go for a long way. Maybe in the coming days, RT becomes more important than the R0. So because that will give a better understanding that how many susceptible people are there. Regarding the asymptomatic cases, this has to come from survey population, from a survey, not from surveillance, because that will be very difficult and very time consuming, and also, in my opinion, very resource intense. So I can also share with you that in Bangladesh, we have started an initiative going for a countrywide survey actually to understand the asymptomatic cases and the symptomatic cases. And that has started. That will take a little time to cover the whole country. We are progressing with that, with the IDCR and ICWB together. So that result will come up. That will tell us that what proportion we have in the community asymptomatic cases. And with that ratio, we can actually extrapolate for the whole country in the coming days. Over.
Yeah, but supplementary question to you. What is the smallest administrative unit of doing this thing?
This depends on the country capacity we have to think of. But if you ask me, I would say that we have to go up to Upazila level or up to district level. And as you said, that we cannot go for the whole country, but we have to have some representative areas in those places so that we can understand the whole country situation. But because there are different measures, I also mentioned, though not in the slides, that we can have some telephone-based surveillance system in place, which can give us some of the symptomatics, and also from the laboratory confirmed cases, we can come up with estimation and also identify the hotspots in the country. And there are mechanisms by means of which we can come up with those hotspot areas.
Okay, there is one question. Do you think that contact tracing is effective at this stage of transmission in Bangladesh? What is your comment on that?
Yes. This is as I also mentioned, that COVID-19 is not like other diseases. It is a completely different. It has got so many things unknown as yet. So I say that we have to go side by side. We cannot just stop the contact tracing. We have to have it along our side. When the cases become too much, we have to go for mitigation measures. But at one stage, when we can control it down, at a level, in that case, contact tracing is very important to keep it controlled. Otherwise, it goes along. So to answer your question, I would say that we have to have both the mechanism in place side by side, and we have to make decision accordingly. If we if we see too much of transmission, that what we are getting now, in Dhaka, we have got a lot of cases, even in all over the country also, the number of cases coming up every day. It is not possible to do the contact tracing everywhere. But if we take it down to smaller administrative divisions, administrative level, like Upazila, or not below, at least up to Upazila, and then the local health department along with the other partners can actually conduct the case tracing and also report centrally. So that can always be done. And to answer your question, we have to go side by side all together.
Yeah, I think Dr. Mohanad is with us. Can I ask him a question? Whether this sort of tracing, contact tracing is going on in his part of the world. What is the status? Dr. Mohanad, can you hear me?
He's muted.
Dr. Mohanad? No? Okay. Okay, and there is another question for you about this lockdown condition. Are we really following the lockdown? Is it really bringing any benefit for us? What sort of measures can you really undertake under this condition? Since the cases are going up and we are just locked down, it is by name, what other measures can we really think to control this situation? Number of cases are going up, as you have already shown. What is your epidemiological knowledge can we use for that? Professor
This is $1 million question you asked.
It is $1 million, but we have to find out the answer.
This question. Yeah, the answer it is like, I would say that it is nothing is very much evidence based, but initially we were getting some benefit of this lockdown, what we had, though it is not a very good lockdown, but initially we had some, and some areas we had real lockdowns also, some specific areas. And that's the reason we have not seen exponential increase of the cases. If you see as I show you, that positivity rate is almost at a level, going a little up, but almost at a level. So that is the benefit what we got from the lockdown, whatever was there. But in country like us, where we have large number of population, and there are a lot of other things about the people's livelihood also attached to it. So that is a problem. So what we should do, in my opinion, as we said, we have to have very good information system placed so that we can go region wise. We cannot go for the whole country anymore. It is almost 2 months, and we have to think of in a way so that where there is transmission more, we have to be more stringent, and also inter-district communication needs to be stopped totally. That cannot happen. That has to be stopped. People can move around in a limited area. That has to be done. And even in Dhaka city, if we talk about it, has to be zoning should be there, and as per zone, decision should be taken. That is the only thing I think that is the only way out at this stage, because after having kept locked down the country for such a long time, that will be very difficult to continue this for longer. Over.
Okay, there is one question to you, that this plasma therapy, how do you think about it? Is it going to really give some solution?
تتعامل معها صح انت بتقدر تشربها. فانا من هذا الناحيه بقول انه كان يعني
Dr. Mohammed, your speaker is on.
Yeah.
So the plasma therapy. Yeah. We can go to Dr. Mohammed after I speak on it.
Is Mohammed ready in here? Dr. Mohammed? No, he's not. No, can you tell us about the plasma therapy?
Yes, plasma therapy is also tried during Ebola period, and that showed some benefit, and also we are also trying, but this needs clinical trials actually to see that how much it is effective, and also there are other issues. So I think this can give some of the vaccine and also with some sort of treatment.
Okay. What do you think about the testing? This is whether we can go for rapid test or clinical decision, or at all we avoid this sort of PCR, because PCR is not really a very easily available test and cannot be done everywhere, as you suggested, for sentinel surveillance or even more contact tracing. Do you think any alternative of the rapid test?
No, rapid, as you know very well, just for people who are asking this question, this is an antibody test, and antibody doesn't develop before 7 days, 5 to 7 days. It varies also from disease to disease. So we can take as that this will become positive IgM after 7 days. And also for this disease, we see that virus shedding is more at the initial days. So its shedding gets less amount at the later stage of the disease. So in that case, antibody test cannot be an alternative of a diagnosis. Antibody test cannot be used for a diagnosis of a disease. That can use for seroprevalence to understand the immunity status. That can be used only for some other conditions, some other places, like even for plasma therapy, you can use antibody test to understand that whether if it will collect samples from that person or not to understand. So this is not the alternative to a PCR, and I don't think that currently the whole world through this PCR. If we have an antigen test coming out, then that will be the alternative. Otherwise, antibody test is not an alternative to the PCR, and antibody test is not for diagnosis. Over.
Okay, I mean, we have to, we are just still waiting for other tests other than PCR. There are a lot of questions about this thing, whether we can get a sort of screening test and then can move over. Yeah, but there is one very important question coming on and on, is that this hospital service that we have at the moment, how can it be improved? At the moment, people are very scared, and it looks that services are not always available at, like a normal life. How can it be improved? What is your suggestion about improving the hospital services, above all the management as a whole, to make it a sort of situation that we can address COVID? Over to you.
Yeah, I can ask as a general public in the country, not as the person who is implementing there, which I did in the past. So actually, the hospital service, I think we need to improve the management. The governance issue is most important here. If we have a system in place, if we follow certain SOPs, we have to follow the guidelines and SOPs very well, and then only we can improve. And we have to have a good system in place. And what I'm telling that these are general discussion, you might think of that anybody will say this, but how we can improve that. The first thing is that if you say me how we can make improvement, we have to make an assessment of the hospitals, the COVID hospitals and the non-COVID hospitals, that what stage are we and how far are we from the standard to give service for COVID. That has to be done. And if we go side by side, improving on that, that will help us in improving the situation of the hospital. So making an assessment and also making, like if we see that there are supply chain is not functioning, or all these PPEs are not there, that has to be strengthened there. If we talk about the oxygen supply, if it is not there, so this has to go for every hospital an assessment, and based on the assessment, the gap has to be filled up by that so that we can improve that.
Okay, thank you. There is one question, with your international experience and connection, what do you think about the SARS, COVID-2? Is it going to be like SARS that we had in the past, or it is going to be even worse or even more fatal? What is your, or is it going to be influenza-like pandemic? What is your suggestion? Three things. Is it going to be is it going to stay like influenza, or it could be a very even more dangerous in the second wave or third wave?
Yeah, it all depends on whether how much it changes, how much mutation it takes place. But for coronavirus, there are some coronaviruses which are they are circulating all the time. But this novel coronavirus which has come, this seems to be a little bit different than the others. This is a very difficult to say that whether it will remain as a seasonal influenza virus like things, or it will go away. That we cannot just say at this stage. The current situation doesn't look like. It seems that this will remain there, which might be very harmful, or maybe a little bit downward also, not very harmful. But if we come up with a vaccine, then that can help us to actually bring it down at a level where we can survive with this. But nobody can tell at this stage that where it will go, whether it will go away like SARS-1, which was there, which was not seen after that. But MERS coronavirus is still there, but at a lower level. So if the situation arises, but those two viruses did not go around the world as it did. So that is an exceptional thing. So
okay. Can you hear? Professor Rahman, can you hear me?
yes.
Okay. There is one moderator's question. This is a question from me. What do you think about, what is your lesson learned over the last 3-5 months? what is the most important lesson that we have learned with the practices either nationally, regionally, or globally? What is the most important lesson that we have learned from this pandemic so far? Have you got my question? Hello? Hello? Looks not.
We didn't understand the actually devastation this disease could do to us. And there was lack of understanding among the people who were in charge at all levels. That's the reason we took little time for preparing ourselves. Though there was lack of preparedness, and even the developed countries who had a lot of resources were found to be ineffective in terms of their preparedness. And the countries, those who have not given enough importance at the beginning, were in trouble. That's the lesson learned. So actually, that is the thing I can tell.
If that is the lesson, overwhelmingly, scientific community is predicting that there is a very probable cause that we will get a second wave. So based on this understanding, what suggestion do you want to make in front of the nation, to the politicians, to our health community, above all to our general public? What should we do? What sort of preparation should we take for the second wave?
Yeah, this is not the second wave, could be for another new virus coming up, which we have to, the answer is that we have to prepare ourselves in a way, and this COVID has given us lesson that we have to have a very perfect system in place so that we can cope with this type of system at all levels. And we have to have all government response together. It is not like health department who can do alone. So everybody will have to come up with their preparedness, and that preparedness has to be there. I can bring up one issue, like when we were getting ready for H5N1, we got H1N1, the swine flu. And then when the country was getting ready for influenza pandemic, suddenly this COVID came up. So that was also globally, we were also not ready to have this sort of pandemic in front of us. That's why there are mechanisms in place for influenza, like influenza pandemic preparedness. There are framework, and there are also fund generation there that how to respond. And that fund cannot be accessed because that is for influenza. And that is a framework done, and that is in consultation, in agreement with the pharmaceutical companies. So here, COVID has learned us lessons that we have to do something beyond a specific disease. Even a new one comes up, we have to get ready for that also, to respond to that. So in conclusion, I would say that we have to learn that how to get ourselves prepared, how to improve the hospital services, how to improve the epidemiological information system. These are very important things to be in place all the time, all over the country. Over.
Yeah, there is one question here I can see, which you can kindly address. At the moment, it is only human to human transmission, but there are evidences, coming up that, from human to animal, the diseases are also going there. And if population, both human and animal population got, infected as a whole, the whole ecosystem or whole the environment could be very disaster. What do you think about this thing? As there are some cases like tiger got infection in New York City from a man to tiger. There are cases that cats are getting some cases. Similar cases are there, and it is transmitting from human to animal. So what do you think? Is it an issue or just a very casual or sporadic?
No, I think if we have to get ourselves ready for anything coming in the future, we have to have system in place where we have to look for diseases, the human-animal interface. That is very important, because though there are a lot of controversies coming up, but we know so far that it has come from the animal. So if any disease coming from the animal, and if we don't take care of that from the very beginning, it gets transmitted to the humans and it goes along with the man-to-man transmission. So that is an issue we have to get preparedness all the time. Doesn't matter when, but all the time, this human element interface, we have to be there. Then the other thing which is coming up, like over the time, when it comes to the humans, it again passes to the human animals that we see in few cases in the tiger and the cats. So that animal might remain as a reservoir of infection also. So we don't know that. So we always have to take care of this, the human element interface, and be alert there so that we don't get into another trouble in the future.
Okay, before we go to the conclusion, there are two more questions. One question, what do you think about this regional collaboration, cooperation, as Sitar presented in his presentation? What is the prospect? How much do you need? How desperate is it necessarily? Can you really focus on that point?
I think this is also very important, the regional collaboration, for so many reasons. One is that even when we go for these measures taken to stop the transmission of the illness, and there are cross-border issues also there. So this is very important for that. And nowadays people move a lot from here to there. So in terms of that situation also, regional collaboration is very important. The another point, in short, to answer your question, that if the vaccine comes up or the drug, we have to have a regional mechanism in place so the countries can get their share properly. So that brings the strength if all the regional countries are together. So I should say that regional effort is always there and it has to be there, and it is necessary to be in the future also.
Good. I'm going to the last question now. This is a question common to all speakers, whoever comes in this webinar. We have been working with One Health for the last decade or so. What do you think about the One Health future? Is it going to work? Is it going to die? Or it has no use? It is just a theoretical framework. It does not have any practical utility, or it does need something to be done with a new invigoration. What is your opinion?
Yeah, you are asking a question to a person who actually believes One Health in heart. So, and I would say that if you look into the past history of the whole world and the emerging infectious diseases which has come from the animal to the human, and that clearly states that we cannot ignore that, and that has to be in place. And even with the SARS coronavirus which has come, if you look into the history. So I would say that One Health has to be there for the endemic diseases, for the emerging diseases. It is needed for everything. It is not only the new diseases which are emerging, these are for the endemic diseases also. So that has to be there if you want to get the good result out of, keep ourselves safe and free. Over.
Thank you very much. I think you have covered both Sitar and as well as your own presentation. It was truly an enlightening discussion and presentation. Thank you very much, participants. I can see still a lot of participants are listening to us. Thank you very much for participating. And it is a really very enthusiastic discussion. And as we can hear or learning from many corners that, we have to live with this. And how can we save ourselves? How can we save our nation? How can we save our globe is our main motto. With these few words, and congratulating again, I'm Nitish Devnath, National Coordinator, and this is being supported by Global Health Development for this IT and participation, and above all, our One Health Bangladesh colleagues who are actively engaged in continuing this webinar. With this word, Professor Mahmoud Rahman, thank you very much for your elegant discussion and presentation. Here is the end of our today's webinar. We'll see again next Thursday or Friday for another webinar. We'll circulate it by tomorrow. Thank you very much. That is the end of our webinar. Thank you.
Thank you everybody for listening and joining webinar.